Hello dear friends, my name is Dr. Igor Atabekov. I'm clinical oncologist practicing since 2010. Today we're talking about low platelets or low thrombocytes, and this is a very big topic, and we are going to discuss only what is the most important, what is appropriate and applicable for usual YouTube watchers, because some causes of low thrombocytes are really seen in very ill, very sick there's patients that are treated in the hospital. I don't think they will sit at home on their sofa and watch YouTube. So let's get started. So platelets are the little structures floating in our blood and stopping bleeding. They produce thrombi. Before I was talking about high platelets, how they're produced. This is the bone marrow. They're produced in bone marrow, but the liver, it produces thrombopoietin, the substance that will stimulate bone marrow to produce platelets. That's why any problem with the liver, for example, hepatitis, cirrhosis, may cause low TPO production and low stimulation of bone marrow. Or platelets can be degraded too much if the liver or spleen are too big. And this happens in, for example, chronic alcoholics or in liver disease again, or in any cause of portal hypertension. Next, any problem with bone marrow can cause low platelet production, or, for example, vitamin or mineral deficiencies. That also seen in alcohol users, in elderly, or in people who follow special diet. For example, vegans, they can have B12 deficiency, and this will cause low platelet production. But also usually they will get low RBCs and leukocytes as well. Or the copper. Low copper may decrease the production of all cells in the bone marrow, and people who are taking zinc, for example, the long intake of zinc will lead to a decrease in copper because they are antagonistic, and this may also cause low platelets. Or, for example, myelodysplasia, mostly seen in already older adults, or sometimes leukemias, lymphomas, or even solid tumors. They can infiltrate the bone marrow, causing this problem, or aplastic anemia. Next, platelets, they live for 8 to 10 days. They are degraded in liver, in spleen. I told you already about the liver and spleen problems as a possible causes, but also they can be overused by the body. There is a number of cases, for example, sepsis, the very severe infection, burns, severe trauma. This may cause usage of platelets. They will form a lot of thrombi, and of course the consumed platelets, and this will be the mixture of a lot of thrombosis in the body and low platelets. By the way, something similar happens in people who have this special reaction to heparin. You know, these anti-clotting injections they make into the stomach or sometimes into vein. What are the symptoms of low platelets? Sometimes it can be asymptomatic, or it can give some minor bleeding or major bleeding. Minor bleeding is bleeding from nose into their eyes, for example, in their throat, in lips or in the skin. Or minor cut may cause excessive bleeding, or it can cause the bleeding into the GI tract, for example, or into the urine. And it's very important to understand, are the platelets the only things that are low? As you can see here, you can see that leukocytes and erythrocytes are normal. Or in this patient, you can see everything is low. And this may be the bone marrow problem. You can see the list of many causes of low platelets. It can be falsely low when there is a problem in, for example, sample. When they take the blood, that means in reality patient doesn't have any problems. I had this in my clinical practice. when I saw the patient with 1, 2, 0 platelets and no bleeding, he feels well. And in reality, when they retake blood and check it in microscope, platelets are fine. But most common cause of low platelets with no symptoms is this second, immune thrombocytopenic purpura. These are autoimmune antibodies against their own platelets. And in such patients, even very low platelets can cause no symptoms. Not always, but often. In such cases, we just recheck, do blood test again, recheck the peripheral blood smear under microscope, and check for HIV and for hepatitis C virus. Very important, because viruses, as you see, can also cause low platelets. And also Epstein-Barr virus and Helicobacter, especially if the person has the ulcer in the stomach or duodenum. Many drugs can lead to low thrombocytes. Quinine containing drugs or beverages, like as you see here, Schweppes can contain quinine, and also many antibiotics, anti-allergic medications, anti-inflammatory medications and painkillers may also cause low thrombocytes. Usually you can see the patient who started to take new drug 1 or 2 weeks ago, and now he has low platelets. And if you cancel this drug, his thrombocytes will be okay after 1 week. Again, alcoholism, liver or spleen problems, very important autoimmune diseases like rheumatoid arthritis or systemic lupus, sometimes in pregnancy, antiphospholipid syndrome, when you see a lot of thrombi in arteria, in venous system, and also problems with pregnancies. Usually these women have miscarriages. Of course, 6% of people will have hereditary problems, and it can be cancer as well. And not only cancer, but also cancer treatment. Chemotherapy, radiation therapy may lead to problems with bone marrow and decrease in platelets, but not only platelets, often white blood cells and red blood cells as well. So what should you do? If you see the low platelets in your blood test, compare it with your previous blood test. Is it a long-standing problem or is it something new? Then, if you have quite high platelets, like more than 100, for example, if you have no symptoms, you can easily recheck it in 1 month, in 2 months. But if you have low blood platelets, if you have some symptoms, then check it faster. If your symptoms are very severe, you're feeling very bad, you're feeling acutely ill, then better call for ambulance. Again, if you're okay, you can go to just general practitioner, recheck your blood. They will see your blood under microscope, because when they check your blood, they can count platelets just by their eye, and they can check for other suspicious signs. For example, they can suspect lymphoma, leukemia, problems with bone marrow. They can suspect some infections or vitamin B12 deficiency. General practitioner will talk to you, will understand if you have special diets, if you have any relatives that had these problems. Check your liver, check your spleen, lymph nodes, see your skin, your mucous membranes, and approximately understand where to send you. Will he treat you himself, or will he send you, for example, to the doctor, liver hepatologist or hematologist? It's a doctor that deals with blood diseases or bone marrow diseases. Maybe to rheumatologist if he suspects something autoimmune, to infectionist if he suspects the hepatitis virus or HIV, maybe to oncologist. If you're taking any anti-clotting drugs, always discuss with the doctor if you need to cancel them, because even you are thrombocytopenic, it doesn't mean you can't have thrombosis. So again, first of all, you need to decide how fast you need to go to the doctor. Check if you really have platelet problem. And treatment, it depends on the cause, because there are plenty of causes and every cause may have different treatment needed. If we talk about cancer patients who drop their platelets all the time during chemotherapy, radiation therapy, it's a separate topic. There is the L-thrombopeg It's a artificial synthesized thrombopoietin, the substance that the liver must produce to stimulate bone marrow, that can be injected to the person. And there are some natural remedies that may somewhat help these patients, but we'll discuss it in separate topics. That's all for today. I wish you good luck, God bless you, goodbye.